Hey you guys, thanks for joining us again. We're going to go ahead and do a short little video today on serial clubfoot casting. Before we even get started, if you're looking for a video that has like an MD or a surgeon or an orthopedic specialist breaking down the definition of clubfoot and why it happens and all those things, probably not the right video for you. This is going to be a video specifically on how to assist the MD when performing serial clubfoot casting, how to hold, how to pad, how to help wrap with plaster. So this will be that type of video. All the more advanced videos that talk about the origins of club feet and all those kind of things, you might want to search further. I invite you to go look for some more advanced sites. However, we have some models here that I brought in, and there's different versions, different degrees of severity to clubfoot presentation. And for the most part, most serial clubfoot casting is a series of 3 or greater. The most common is 5 to 6, and usually what they'll do is, depending on the severity, and again, it just depends on the actual orthopedic surgeon, they will typically present, once they've discussed with the parents and everybody's on the same page and they have agreement, they will approach each foot, gradually taking the foot from something like this to something more like this, and maybe even a little bit more, and then eventually the discussion will come in afterwards towards the 5th or 6th or maybe more series in the cast, discussing where to go from here. Do we stop here? Do we switch to bracing? Do we switch to an Achilles release? All these things are advanced discussions that we will not get into in this video. So that being said, what you need to have in preparation for your surgery, you need to have at least the minimum stockinette, cotton padding, plaster, which is the most common thing used for clubfoot casting. There are some surgeons that will use fiberglass, not very common. And the other thing too, a quick trick here, you will use web roll type padding, cast padding, but to make your life quite a bit easier, I strongly recommend taking a 2-inch roll of web roll padding, getting a scalpel or a straight razor or some type of blade or really strong scissors, and transforming a 2-inch into 2 smaller 1-inch ones. Most of the time when you're working with club feet, I have found that a smaller roll, you can do a lot more with this. You can manipulate better. You can actually apply it better. It works really well, and I'll get into that when we're doing the demo here in a minute. So padding, stockinette, plaster, club feet models. So we're going to go ahead and pause for a second while I get some stuff set up. Some surgeons will use a small stockinette at the toes, just like so that once you have the cotton on, you can fold this over like so. Some surgeons will not. They'll only use a larger strip, slightly larger, because again, we're working with really small ones here. We're working with, babies that are only a few days or a few weeks old. They'll take a longer strip and they'll just send it all the way down to the upper leg, so that way once we wrap the upper leg, if in fact they're doing a long leg, which we'll get into that in a second, they can fold it over like so once the padding and the fiberglass, the plaster's on. So those are the 2 types of stockinette you'll be asked for from the surgeon. So it'll look something like this, a longer piece and a shorter piece, something to that. So we'll go ahead and we'll just say for video reasons, we'll say that that's what we're going to do. We'll do a long strip for the upper leg, and we'll do a short one for the toes and the foot. Majority of people doing serial casting, well, I don't want to say majority, but a good portion of people that are doing serial casting, providers that are doing serial casting, they tend to do long leg serial casting. There are surgeons out there that do short legs. I am not qualified to tell you if one is better than the other, if you should select one, or if that makes a difference in the choice of your surgeons. I am not qualified to have the discussion. I am only qualified to present the different methods of assisting. So at this point, what your surgeon will have you do is either one of 2 things. They will either have you hold for them, and they will direct you where to hold, or they themselves, he or she, will do the holding and have you as the ortho tech proceed with the wrapping of the cotton and the plaster. So in this particular case, we're going to bring an extra set of hands in so that we're going to go ahead and get it kind of repositioned here. I'm gonna assume to be the surgeon. Again, that's wishful thinking on my part. I'm going to have the orthotech hold the toes and have them get a pretty decent grip and position the foot where I think it should be. Again, this is going to be a little bit more mobile than normal because there's no body here. This is just the model, so we'll just have him hold there for a sec and kind of keep it in a neutral position for video reasons. If you want to bring the while he's holding, most, depending on the severity of the club feet, whether it's something like this or something like this, they will not try to get this in the first one or two casts in the series. That's not appropriate. What they'll start off with first, the first 1 to 2 casts, they'll start off with just trying to bring the foot down. Just trying little by, that's the whole reason they call it serial casting. You gradually, 1 cast, 2 casts, eventually the 3rd cast, possibly the 3rd, the 4th cast, possibly, and then eventually something to this nature is what your optimal goal is. But again, each one it's a progressive type of casting, a little bit at a time, each cast a little bit. So what we're doing is we're starting with this model just to show how you would hold, and basically the surgeon, let's say for example, let's reverse this. Go, no, you're fine. I apologize. Let's say that this is the surgeon holding, and I'm going to do the orthotech thing. Now, first things first. We're turning the foot this position. So if you're turning the foot this position, you want to roll your padding in the same direction that the surgeon is trying to get the position, the direction we're trying to go in with the positioning. Just like so. If you come over here, you keep holding, you stay there. If you were doing this one, or if you were doing this one, and the surgeon was holding in this position, you would roll your cotton this direction. And the same goes for the plaster. You want to go in the direction that the surgeon is going in. You don't want to work against your provider, you want to work with your provider. And again, the benefit is 100% for the child. So we'll go back to where he's holding. There. When you come to padding the heel, you want to not put too much padding here, because again, we're trying to shape the foot, shape the cast. We're trying to redirect the position of the foot. So what you do is you come around, you overlap like any cast, halfway every time, and you kind of have like a little tango with the 4 hands involved. You're kind of all working with each other. So as you're doing your thing, this hand will move, my hand will move. We'll work with each other. So all 4 hands, we're all trying to achieve the same goal. Then you come down here at the heel, because you have to reinforce the heel, you have to, so you avoid pressure sores, and you do little strips, just like so, little strips, not a big deal, just little bitty strips. Now, if your surgeon is doing a short leg cast, this is it. That is all you do. You wrap it with the plaster, and you go on from there. Now, that being said, some surgeons will start with a short leg cast, and once they get the shaping that they want, because this is our priority, they'll move on to a long leg. They'll continue it upward. So that being said, let's say that we're going to go ahead and do a long leg. We're doing a long leg. So what we're going to do is we're going to take our plaster. We're going to start with the short portion, and then we're going to work our way up. Now, this is completely where all the variants take place. You have one surgeon will be like, stop here. Let's do the plaster. Another surgeon will be like, nope. Go ahead, run it all the way up to the top with the cotton. Keep going all the way to the top with the cotton. Just get all the cotton out of the way first. There you go, I'll work around your fingers. We're having our little tango dance. They're gonna want you to go up as high as you can near that diaper line, that bottom diaper line, so you get more leverage. Okay, then the surgeon's gonna be like, okay, now that we have all the cotton on, let's do this portion first so I can do my shaping and my molding, and then we'll continue on with this. So there's different variations. It just depends on the provider. So I'm going to wet the plaster. Some providers will want you to do strips. 3 of these, a reinforcing strip over the knee, reinforcing strips so that they don't have to make the plaster overly thick. This will create an anterior spine for strength so they don't have to put wads and wads of plaster on there. So some will ask you to do this and then roll your plaster. So that, just so you know, that's another variation. Pause. Okay, so we had to pause so that I could wet the plaster. So again, just like we did with the cotton, this is the surgeon right here, and the surgeon's going this way. So let me work with the surgeon. And again, all we're doing is laying the plaster on there. The plaster is a little bit different than the fiberglass. You can actually give it a little bit of tension. You can give it a fraction, just a fraction more tension than you would give the fiberglass. This particular surgeon I'm working with today wants me to stop at the lower end here, and then we're going to continue up in a moment with the second half of the cast. But the reason they want this is so they can come in here and shape where the clubfoot exists. They want to be able to shape it because when you get to the top of the leg, all you're really going to do at the top of the leg is just make it flat to keep it from sliding. If you go further down the video list on this channel, you'll see videos with plaster where we have clubfoot babies and we're showing how to remove the plaster cast. Now, what I'm doing now is just smoothing it all out. I'm just smoothing it all out, and then what's going to happen is, there's a term for this, it's called sugaring the cast when you work with plaster, and it gives it that smooth appearance that we all remember from the old days. I'm just going to use the paper. And then what's going to happen is the surgeon will have you hold up here while he or she, go ahead and let go for a sec, while he or she starts doing the shaping. You can come around any angle you want. And they'll come in here and they'll start shaping the cast exactly how they want it. I'll move my hand out of the way so you can see. So they'll come in here and they'll kind of start manipulating, and so on and so on. And then once this starts to harden, we're going to continue upward up to the top of the leg. And so once the lower half starts to set up, we're going to start rolling the upper half now. And I'm going to start about mid-shin so that I get a good catch from the original cast. And here we go. Some people prefer to wear gloves when they're working with plaster. That's fine. It's your choice. Working barehanded with plaster essentially doesn't do a lot of damage, other than, you know, if you're doing it all day long, you're going to end up with really, really dry hands. Thank you. You're going to come down to where you have a little lip of cotton. Thank you. And then we're going to pull the stockinette over. There you go. Thank you. Just like so. You're going to come down with what's left and you're going to reinforce the bend here, and if you have enough, you're going to reinforce the bend there. When you're working with newborns that are only a few days or a few weeks old, 2 rolls is usually adequate. Now, if you're working with a baby that's, you know, older than 4 or 5, 6 weeks old, you're going to probably either need to use a 3-inch versus a 2-inch, or you're going to have to use a little bit, like maybe a little extra, like maybe 2.5 rolls maybe. So I'm going to go around. I'm going to make the whole thing look like it's supposed to look, like a cast. And like I said a second ago, if you guys are really interested on how we're going to remove this, rather than making a whole lengthy video and cutting this cast off, just go down the library all the way down about a year back, and you'll see a really, really great video on a live patient, a live baby, how we take plaster cast off with the cast saw. Now, some providers, thank you, some providers will instruct the patients to soak the cast off at home before their appointment, which you can do with plaster. You can soak it off at home. You're going to put a flat hand on the thigh, This is pretty much set up already where the doctor wanted it. So now what you're doing is you're creating a flat top surface to help decrease the odds of slippage. You do this for about 2 to 3 minutes. Along the way, you kind of take your hand off, kind of do the niceties that, you know, to make it look like a cast, you know. And that is your very, very basic assist on a serial clubfoot cast. And then what we'll do while this is setting up, so that we don't waste your time, we'll pause for a second, and I'll come back with a couple more pointers for you. And you can actually just. So that's pretty much the basic how to assist with a serial plaster cast, clubfoot cast. Some little key points just to kind of close down the video. If the parents call you and the edges, particularly the top edges, are damp, or they may have little pee stains or little poop stains, that's okay. It's okay. It's not a big deal. They can wipe it, and if they're comfortable with that, that's fine. Now granted, if the baby has a ridiculous blowout in there, we have to change out the cast. That's just all there is to it. We have to change it out. But if it's just a little pee or poop stain or a little wetness from the wipes or whatever, it's okay. Not a big deal. On the toe side, you always want to have the toes at least a little bit exposed, at least a little. This is a bit much. We probably could have gone a bit longer with this cast in full transparency. However, you want to have at least the tips exposed so the parents can keep an eye on them, and so they can tell if the toes are starting to have slippage and they're starting to disappear into the cast, then you know that if these are starting to disappear, you know that the heel is slipping up. And if the heel's slipping up, they need to get a hold of you pretty promptly, because you're going to end up with problems back here that's going to upset, well, obviously the baby's going to be upset. They're going to be very, very fussy, but it's going to upset the parents if it starts to have tissue breakdown. So those are 2 items that you really, really need to look for. The other thing too, make sure you have a good amount of space or a good amount of padding so it doesn't rub and cause any problems. The parents will also, when this happens every single time on a serial cast, the parents will come to you. Well, they'll mention it as soon as you remove this first cast, and sometimes even the second cast, the second in the series, because the doctor is pushing so much. You can even see it on the model. Because the doctor is pushing so much, you're going to end up with some really intense creases in the skin. So something to this effect, like this. And that's going to be inside the cast for a week at a time. Sometimes if the people live out of town, they're going to be in this serial cast for 2 weeks at a time. And that's going to have some serious skin folds inside the cast. And of course, when the cast comes off, they're going to have little folds of maceration. That may concern a first-time parent. And that's okay. That's normal. The doctor will explain to them that is a normal process of bending the foot in a position that it didn't start out in. I think those are the key points. I don't want to overtalk it. I want to thank you guys for joining. Thank you to all the new subscribers. I think since the last time we made a video together, I think we have like another 100, 200 subscribers, which is amazing. If you have any questions, please throw them in the comments. Again, not a super in-depth video, just how to assist the surgeon for serial clubfoot casting. Trying to keep it basic. You guys, everybody, have a good day, and we'll see you soon.